Hey there and welcome. In today's video, we're diving into the world of clove oil, a powerful plant-based remedy with deep roots in history and modern science. Whether you are looking for pain relief, antimicrobial support, or just curious about natural wellness, you'll learn what clove oil is, how to make a version at home, how to use it safely, and who should avoid it altogether. Clove oil is an essential oil made from the flower buds of the Syzygium aromaticum tree, also known as the clove tree. These buds are dried and then distilled to extract a rich, aromatic oil. Its main active ingredient is something called eugenol. This makes up about 70 to 90% of the oil and is responsible for most of its benefits, like its pain-relieving and antibacterial effects. There are also other minor compounds, like V-caryophyllene and eugenyl acetate, which help round out its properties. Together they give clove oil its distinct smell and powerful punch. In all, clove oil isn't just something that smells good. It's been shown to have real, science-backed benefits. First, it's antimicrobial, which means it helps fight off bacteria, fungi like Candida, and even some viruses. It's also anti-inflammatory, helping to reduce swelling, and analgesic, meaning it can numb pain. As an antioxidant, clove oil helps protect your cells from damage caused by free radicals. Some studies are even exploring its anti-cancer potential. Although that's still early-stage research. Dentists have used it for decades because it acts as a local anaesthetic. You'll find it in some toothache gels and dental treatments. Now, if you want to try clove oil at home, here's how to make a gentle, infused version. Not the pure essential oil, but a milder alternative you can still use topically. Just take 1 cup of dried whole cloves, smash them gently, and combine with a neutral oil like olive or fractionated coconut oil. Seal in a glass jar and let it sit in a dark place for 1 to 2 weeks, shaking it daily. Then strain out the solids. And boom, you've got clove-infused oil. Use it on your skin or in oil blends, but keep it away from eyes and sensitive areas. Here's something important. True clove essential oil is made using a method called steam distillation. This uses pressurized steam to pull the oil out of the plant. It's not something you can safely do at home without special equipment. DIY versions won't be as concentrated or pure, and improper setups can lead to burns or contamination. So if you need a strong product, it's best to buy from a reputable supplier who uses proper lab testing. And speaking of buying clove oil, here's how to shop smart. First, look for the species name on the label. It should say Syzygium aromaticum. Make sure it's labelled 100% pure essential oil, ideally steam distilled from buds, not leaves or stems. It should come in a dark glass bottle to protect it from light, and if you can, choose a brand that offers GCMS testing, that stands for gas chromatography mass spectrometry, which is just a fancy way of saying it's been checked for purity and safety. Now let's talk about the most famous use of clove oil: oral health. Clove oil can relieve toothaches fast, sometimes in as little as 5 to 10 minutes. That's thanks to eugenol's numbing effect. It also kills bacteria that cause plaque and gum infections, and some dentists use it mixed with zinc oxide for temporary fillings or to treat dry socket. If you're using it at home, dilute just 1 drop in a teaspoon of carrier oil. Soak a cotton swab and apply it directly to the sore spot. But be careful not to swallow it. If it burns or irritates you, rinse immediately. Clove oil can also be used on the skin for things like chronic itching, anal fissures, or joint pain. Again, the key is its anti-inflammatory and numbing properties. Never use clove oil straight from the bottle. It's too strong and can cause burns. Always mix it with a carrier oil, and only apply to small areas after doing a patch test. Clove oil also shines as an antimicrobial. It's effective against Candida yeast, acne-causing bacteria, and can help with minor skin infections. Some people use diluted clove oil in hair oils or scalp treatments to reduce itchiness and dandruff. Just be sure to test on a small patch of skin before applying widely. This is where things get serious. Clove oil is very concentrated, and misuse can lead to real harm. Even small amounts, especially if swallowed, can cause nausea, burning, or worse, liver or kidney damage. It also slows blood clotting, which makes it dangerous for people with bleeding disorders or anyone about to have surgery. There have been cases where adults overdosed on as little as 10 millilitres. That's only about 2 teaspoons, so respect its potency. Clove oil is powerful, but it's not for everyone. You should avoid it completely if you are pregnant or breastfeeding, as there is not enough safety research. Do not give to children under the age of 3 years old, because even a tiny amount can be toxic. Individuals on blood thinners or those who have a bleeding disorder should avoid taking clove oil. And lastly, those living with liver disease or taking medications that stress the liver should also avoid using clove oil. Be sure to always check with a healthcare provider if you are unsure. So here's your quick checklist for safe use. Always dilute clove oil, 1 drop to 1 teaspoon of carrier oil. Do a patch test on a small area of skin first. Only use the clove oil externally only and never ingest it. Rinse it off immediately if you notice any burning or irritation. And remember, if you have ongoing dental pain, see a dentist because clove oil is not to be viewed as a permanent solution or replacement of adequate dental care. To wrap it all up, clove oil is a natural remedy. It's rich in eugenol and antioxidants and can help with everything from toothaches to minor infections. But just because it's natural doesn't mean it's harmless. Treat it with the same care you would a medication. With smart use and good sourcing, clove oil can be a safe and effective part of your home health toolkit. MIDPHC would like to thank you for watching, and if you found this helpful, don't forget to like and subscribe for more public health content. See you in the next video.